Crest View Recovery Center is a safe haven for addiction recovery.
It's located right here in Asheville. It has helped countless people get and stay sober.
News 13's Stephanie Santastasi shows us what makes it unique in today's addicted America.
This big brown building blends into the landscape of downtown Asheville. It's located right off Ashland Avenue and has served as a place for people to recover from drugs and alcohol for more than 6 years.
Our typical clients stay with us anywhere between, a little over a month to 2 or 3 months.
Crest View Recovery Center has 46 beds.
They go to groups, they see therapists one-on-one, they meet with a doctor for any needs that they have while they're here, and they build a community inside their safe quarters here.
Dara and Dara Heimowitz are the co-founders. The two are in long-term recovery themselves. It's actually where their love story began.
It's a pretty beautiful experience, we had worked on ourselves first, individually, and then we met.
Now they help people on their own recovery journeys, people like Beth Loveland.
This is the waiting room, and this is where I said goodbye to my mom.
Beth checked into Crest View in January of 2021 after getting a DUI. She says she had always been a drinker, but she began experimenting with drugs too.
So my drug of choice was cocaine, and it was like the best serotonin boost I'd ever gotten in my life. So at first, it was fun, and it was every once in a while, and I would stay up all night and hang with my friends, and it was great. And then it just got to the point where I was using just to feel normal.
Because of her addiction, Beth got evicted from an apartment, lost a job, got a car repossessed, and eventually was arrested.
It just was not conducive. You can't live that way.
She knew she needed to go somewhere for help.
We called a couple and we asked about price and what was going to cover, and what each one offered. And Crestview just had the things that they offered outside, like yoga and hikes through the woods and that sort of stuff.
When Beth wasn't at the recovery center, she was here living inside this apartment complex provided by Crestview. She got to stay here the entire time she was in recovery. Each one comes with a kitchen, a living space, and multiple bedrooms.
I was here for 40 days.
What did you learn about yourself over those 40 days?
That I'm tenacious. I got a lot of my tenacity back, and that felt good.
Beth is just one of dozens of success stories to come out of here.
I'm better off where I am now because I knew I needed help. I knew my life wasn't sustainable.
And it's all because these two knew they needed to give back to a community that continues to help them on their own recovery journeys.
It's been a wild ride, but I wouldn't trade it for anything.
It's a trend in the wrong direction.
On average, about 9 North Carolinians died every day from an overdose in 2020. That information comes from new data from the State Health Department.
News 13's Samir Nefsi looks at how our area compares to the statewide overdose epidemic.
The latest data from the State Health Department shows that in 2020, overdose deaths surged by 40% compared to data from 2019. Now, state officials and local advocates believe the ongoing epidemic was worsened by the ongoing COVID-19 pandemic.
It's really unfortunate to see that increase. That is a sizable increase.
Newly released data from the State Health Department shows over 3,300 North Carolinians died from drug overdoses in 2020 compared to just over 2,300 in 2019.
Our program alone in the past year, we had over 2,500 individuals report of an overdose. We've distributed over 15,000 naloxone kits in this past year.
Experts believe the significant increase in overdose deaths is a product of an epidemic and pandemic converging.
We were experiencing the pandemic and all the different stresses and the different impacts, not just to the disease itself, but all those other things that we know were equally important.
As COVID kind of forced self-isolation in the very beginning, a lot of folks were left at home, left to their own devices. A lot of mental health played a huge factor in that. People that were already in recovery pretty fairly often return to use.
Just really tragic to see that increase again. And so we know that certainly, again, we need to work on these multi-sector collaborations across the state, working with our providers and treatment community, working with our community-based organizations.
Raymond Velasquez says in addition to supplying naloxone, WNCAP provides naloxone training for staff members in areas like bars and restaurants where ODs could happen.
Having the staff on hand knowing what to do in that situation could save a life.
Now, more than 70% of overdose deaths involved fentanyl, while provisional numbers for 2021 also indicate an increase in overdose deaths.
A student from Southwest High School who captured the video of a teacher during a verbal outburst is speaking out. Onslow County School says the teacher has since resigned, but parents and students still want answers on how the situation got so out of hand. News Channel 12's Megan Scarano talked to the student who captured it all on camera.
Samaya Josie is a sophomore at Southwest High School who recorded a part of the outburst on her phone. She says she started recording because she didn't think people would believe her when she told them what the teacher said to the class.
Because I am done playing with you idiots.
I was scared. I didn't know what to do.
Samaya Josie says it all happened during first period after the teacher told the students to put their phones and computers away. She says one student didn't listen and then made a joke. She said that's when the rant began, but what bothered her the most was this comment made to the class.
You can go through life and live on the system, draw your paycheck on the 1st and the 15th from my taxes, and live just an absolute horrible life. I don't care. You can be another statistic.
I felt like what he was saying was wrong. I felt like it was racially motivated. It was disrespectful. Your job is to encourage me and to push me to be the best that I could be. Even though it wasn't said directly to me, it just felt like, dang, that's how you really think of us.
Her mother, Nikki Josie, says the teacher crossed the line with his language and with his aggression.
Even as her mother, even to listen to the video the first time, I had tears form in my eye.
And if you don't like my language, I don't give a because you've said worse. And if you, again, Samaya, you leave too. Get out now. Get out.
I'm not.
Get out now. I didn't.
Nikki says while she may not condone her daughter's actions that day, she defends them.
I think the respect went out the window a long time ago. And truthfully, that was fight or flight mode for her.
When you look back, do you think you should have done anything differently? Or do you stand by everything that happened that day?
I don't think I did anything wrong. If you was in my shoes, how would you feel? Like, what would you have done?
Again, district officials tell us the teacher resigned on Friday. We've been asking questions to the school district since the video was brought to our attention on Friday. They released a statement today saying this behavior wasn't tolerated, but they have not answered any of our direct questions, including what led up to this outburst, who the teacher is, how long he's been with the district, or whether he's had any other disciplinary actions. They have received the request and we've been waiting for a response.